But there could be a COVID-19 vaccine for kids 5 to 11 by Halloween. Pfizer said it is getting closer to submitting for an emergency use authorization. After that, the FDA will evaluate the benefits and risks, a process they say could take just a matter of weeks. Several health experts say they expect authorization by the end of the month. And with any new vaccine approval comes many questions from parents, and we know a lot of concerns. So we turn to a local pediatric disease specialist at Louisville Norton's hospital. WHS 11's Rachel Droz is here now to verify the answers on what you need to know.
With emergency approval for a COVID vaccine for kids likely right around the corner, a lot of parents are wondering, well, a lot of things. I pulled some commonly asked questions and got you answers.
The first question is about vaccine approval. If the FDA does in fact grant emergency use authorization to the Pfizer vaccine later this year, how would they be able to do it so quickly? My source is Dr. Daniel Blatt, a pediatric infectious diseases doctor at Norton Children's. He says while it seems like they're approving this vaccine fast, in reality, it's a pretty lengthy study and follows other bigger studies done on adults and kids 12 and up.
Historically, we have more people in this trial for the child vaccines than we do in most other vaccines. So we have more data than most other childhood vaccinations.
Next question, how will kids react to the vaccine? And will side effects be different than what we've seen among teens and adults? Well, Dr. Blatt says we need to wait and see the data from the studies to know that answer. But he says historically, kids have had better outcomes from vaccines than adults.
Often they produce a really good immune response, but it really depends on the vaccine and it depends on the child.
Information on the FDA's website shows 12 to 15-year-olds experienced similar side effects as those 16 and older, such as arm soreness, fatigue, body aches, and chills. And finally, let's talk dosage and why the FDA says doctors can't start vaccinating your kids before it's approved for their age group. Dr. Mark Burns, an infectious diseases specialist at U of L Health, says kids often need different doses.
Children are not little adults, okay? They are children. And so, again, they have to determine what is the correct dose for them.
If the FDA and CDC sign off on the vaccines, both doctors Burns and Blatt say they can start vaccinating kids that same day. With your Verify, I'm Rachel Droz.
Don't forget, if you want the Verify team to look into a major question for you, send us an email. The address is verify@whs11.com. You can also reach us on Facebook and Twitter.